In terms of our department here, we have 15 people on staff. Day to day, you're assigned to a different unit. It could be the case room in which we attend high-risk deliveries, the neonatal intensive care where we take care of the newborn babies age range, and in the pediatric intensive care where we take care of anybody from basically 25 days old to 18 years old. And we also cover the emergency department. We're a part of the trauma team and any of the cardiac arrests or anything like that.
We have an operating budget from government that allows us to provide services. But because we're such a specialized area, particularly when I speak to like the neonatal intensive care unit, there are a lot of highly specialized equipment and supplies that are very expensive that are above and beyond typically what our operating budget can provide. When it comes to specialized equipment, including respiratory equipment, we often go to the Janeway Foundation to request things that is beyond our ability to fund under our operating budget. So these items again can really increase the level of care that we're able to provide in the NICU, PICU, and throughout the Janeway really.
As a respiratory therapist here at the Janeway, we are not just only here at the Janeway. We actually will have to go to rural sites, including Goose Bay, St. Anthony, Corner Brook, Burin, Grand Falls, Gander, Clarenville, all the hospitals that deliver babies.
Basically what we call an ICU on wheels, a transport team for the neonatal age range that will go anywhere in the province to pick up newborn babies that need to come to the Janeway specifically for treatment here that they can't handle in the rural area.
We'll travel either by ambulance or by plane to go get these babies and bring them back here to the Janeway, to our tertiary care center, where they can have the extra assessments done.
For me, I find this to be an incredibly rewarding job. Of course, it has its sad points, but specifically, I always think about the newborn babies who need you right then and there.
There's been a couple families that have really touched my heart and pulled on your heartstrings, and to be able to take care of them and just help them through those tough times.
This is our pulmonary function machine. With this machine, we're able to do a number of non-invasive tests that can tell us how well the lungs are working. Results from pulmonary function testing can help in the diagnosis and treatment of certain lung diseases. Some common ones we see here are asthma and cystic fibrosis, but of course there are many others. Pulmonary function testing can help as a tool to monitor any of our kids in Newfoundland and Labrador who may have respiratory issues.
From a manager's perspective, I have a service that's absolutely integral provincially for providing the best care for patients, and I also have a staff that are very, engaged, involved, want to provide the best level of care to their patients. I get a lot of enjoyment basically out of that because of the team that I have working with me, and we can make a lot of difference in the lives of patients and their families.
So that's why it's so important for folks to continue to give to the Janeway so we can continue with this specific specialized care that we have here.
Being able to give the treatments that rural centers cannot give is very important, and it's very satisfying to see the equipment that's being used actually help a patient overcome their respiratory illness.
There's so many services that we're providing here that really would be impossible without the generosity really of Janeway Foundation donors.